So what do we know about atrial fibrillation? We know that atrial fibrillation places a patient at higher risk for developing a stroke or heart attack. So they need to be treated. Some complications associated with atrial fibrillation are stroke. Decreased cardiac output occurs, which could greatly place the patient at risk for passing away. So, the first thing we want to always know are a few factors before a patient is treated for atrial fibrillation. Generally, anticoagulants is going to be one of the medications that's going to be used. It is also important to know a patient's bleeding risk. Have they ever had gastrointestinal ulcers? Do they have some type of underlying bleeding disorder? Do they have cancer or liver disease? There are different factors that are going to come into play to determine if a patient with atrial fibrillation will be treated with anticoagulants. However, one of the things that we know is that there is chronic atrial fibrillation and then there's acute. There's uncontrolled and controlled, basically. So if the heart rate is elevated above 100, they definitely need to be treated. And sometimes patients come in the hospital and they're treated with heparin infusions. Like I said, depending on the bleeding risk, and then they're going to need long-term therapy for treatment with the anticoagulant. And there are other medications that we use to treat atrial fibrillation. Like and subscribe.